My name is Cameron Sheehan. I am a third-year resident, and welcome to the Baylor Department of Otolaryngology. Baylor Otolaryngology is unique in that our residents cover 6 medical institutions, all within the Texas Medical Center. The Texas Medical Center is a 2.1 square mile medical district just south of Houston. That's actually the largest medical complex in the world. In fact, the medical center continues to grow every day with exciting upcoming plans for the development of TMC3. There's so much to learn about each individual hospital that we cover, but I'll leave it to the service chiefs and chief residents to fill you in a little bit more.
So Bentop is a tertiary care hospital for the Harris County. Harris County is the 3rd most populous county in the United States. It serves the uninsured, largely patients of Harris County. The chiefs are largely in charge of running the service, both inpatient and outpatient. They control the OR schedule. They share responsibility of patient care with their attendings.
The Houston VA is one of the largest VAs in the country, and as far as the otolaryngology service is concerned, we are the largest VA in the country, both from the number of patients we see on a daily and a yearly basis, but more importantly, the amount of surgical service we have. We surpass the nearest closest 1A facility by over 50%. We operate 5 days a week on the entire gamut of otolaryngology, but we have a heavy concentration of head and neck cancer, obviously because of the veteran population.
As chiefs at the VA, we have the ability to see patients in clinic and then book them as our cases for about 2 to 3 days out of the week in the operating room with the faculty of our choosing based on the different subspecialties of head and neck surgery, sleep surgery, facial plastics, rhinology, laryngology, and otology and neurotology.
What I would like the residents to get out of the rotation is an appreciation for the vets, an appreciation for their own diagnostic skills, an appreciation for the operative opportunities that we give them.
Texas Children's is actually the largest children's hospital in the country. We have Baylor residents with us 100% of the time, and we are all Baylor faculty. So, as a PGY1, for example, you would learn basic otolaryngology examination skills. You learn surgically how to put ear tubes in, how to take out tonsils and adenoids, how to do an incision and drainage on an abscess. As a PGY2, you continue developing those same skills as well as some more advanced skills. Some of the soft tissue work that we do, some of the basic ear type surgeries. As a PGY3, then you extend your repertoire even more and do a little bit more head and neck type surgery, some of the more complex ear type surgeries, some sinus surgery. So it's really graded by level.
So here at Houston Methodist, we take care of all kinds of patients. So a full spectrum of different kinds of diseases and pathologies and settings. One of the interesting and neat things over here is we work with a distinct group of faculty that mostly come from a private background. And so we really get a different sort of lens and experience here. The team here includes one of the Baylor 4th-year residents. One of the neat things here, we work actually usually with a UTMB, either 3rd or 4th-year resident. And then there's a 2nd-year Baylor resident. And then sometimes we'll have a medical student. Right now we have a medical student on the service from Texas A&M.
We work very closely with the head and neck surgeons, head and neck medical oncologists, and head and neck radiation oncologists while at MD Anderson, and offers a breadth of educational opportunities in each department. We also work closely with nutrition and speech, especially on our inpatient service, in order to deliver the best care possible for our patients. I can't say enough to the education that I have received over here at MD Anderson, and you really can't find a close comparison in this nation, especially when talking about cancer care, because here in Houston, they really are leading the wave.
Our team is made up of a PGY 1, 2, and 4. We get to experience the private Baylor clinic and surgical practice. Almost all of our adult ENT attendings operate at St. Luke's. for the interns, this is a big introduction into the adult otolaryngology world. The caseload here is incredibly diverse and can be tailored to your interests when you rotate through. This hospital gives residents the opportunity to act as consultants in a very busy hospital with a variety of ICUs, including the neuro ICU with a large amount of combined neurosurgical cases, the surgical ICU with a large amount of head and neck cases, as well as the cardiac ICU with a number of complex consultations. This rotation really has it all in terms of cases, ranging from head and neck to transsphenoidal work, sleep surgery to plastic surgery, rhinology to otology. This is your time as a resident to learn from our adult faculty so that when you get to the public side, you can emulate their good example both in the clinic and the operating room.